Welcome to ASRM Today, a podcast that takes a deeper dive into the current topics in reproductive medicine.
I'm Jeffrey Hayes. It is Stress Awareness Month. Today on the show to talk about stress awareness is Dr. Ariadna Cymet-Lanski. Dr. Cymet-Lanski is a clinical psychologist and chair of the ASRM Mental Health Professionals Group. Dr. Cymet-Lanski, welcome to ASRM Today.
Hi, Jeff. I'm pleased to be here.
Fantastic. Well, I want to start off, since this is kind of a tradition now with the show, since this is your first time on, could you tell our audience a little bit about yourself? How did you come to be working with people in the field of reproductive medicine?
Yeah, thank you for that question, because it was one of those things that I was sort of presented the opportunity and I took it, but wasn't aware of where this was going to take me. So I'm in Chicago. This is where I completed my doctoral degree. And during my postdoc, I was working with pregnant teens. That's kind of how I came into the world of reproduction. After I finished my postdoc, I went into private practice and was really working more with pregnancy. And through that, I one day was just scrolling through the Illinois Psychological Association, and this position at a fertility clinic here in Chicago appeared, a part-time position. It sounded so interesting. I applied and I got the position. And so I was in-house at a large fertility clinic here in Chicago for 6.5 years. And it was fantastic to be able to work with physicians, with the nurses, with embryologists. It really sort of gave me this amazing view of the field and patients and all kinds of difficulties that the reproductive world brings sometimes to our patients and to our clinics as well.
Yeah, I was kind of in the same boat, because my background is in education, and I was getting married at the time, and ASRM had this job posting for an education specialist. I said, well, that's strange. I'm an education specialist. And I had no idea about reproductive medicine or, any of these things. But yet here I am 8 years later, and still learning, all sorts of things that I could never imagine. It is really a fascinating field, and you don't realize how big it is,
yes,
when you do it. So I want to ask you then, we know that it's not clear how stress impacts fertility precisely, but it certainly exists, for people trying to create a family. I want to ask, how can stress affect a person who is trying to start a family?
Yeah, that is a question that I tackle. So after this large fertility clinic that I was at, I moved back to my private practice. And so I now work with actually a lot of the clinics in the area. So I still get to see a lot of patients trying to conceive. And that is really one of the almost first questions that come up. People come into my office. They're very stressed. They feel like they have to manage stress because that is getting in the way of them getting pregnant. And it's always such a difficult question, because they're really, if we look at the research, there's really nothing that supports either one. You cannot get pregnant because you're too stressed, or stress has no impact on it. There's really, if we look at it, almost falls 50-50 in the middle. So what I tell patients is that there's some relationship. We don't know exactly what it is, but there's not a correlation just yet. The one correlation, 100% that we know, is that if you're doing fertility treatment, if you're the recipient of fertility treatment, your levels of stress are going to be extremely, extremely high. And I quote some research that some amazing colleagues of mine have done, some of them right here in Chicago at Northwestern, where they talk about how stress from fertility treatment really is at the same levels as patients doing cancer treatment. So it becomes almost this life and death stress. You're really fighting for something that is really meaningful for patients. And as they're going to treatment, you really feels like their lives almost depend on it. And so one of the things that I tell them is that our work together will really focus more on how to manage stress so they can continue to move through fertility treatment and therefore increase their chances of being successful. We know that the other thing that I think one of my other amazing colleagues in Boston, Dr. Dahmer, has done is that patients leave treatment, or one of the main reasons why patients leave treatment is actually stress. Sometimes we think that it might be finances, it can be a health, but it really is stress is one of the main factors that our patients leave treatment. And so if you're not doing treatment, it might be much harder to get pregnant. So if you stay in treatment, if you're able to manage your anxiety, you're more likely to stay in treatment and therefore hopefully be successful in the long run.
I'm sure too that our listeners that are physicians are curious about, because, much like so many fields which are service-based, whether you're a teacher, a doctor, or what have you, I think you suddenly find yourself having to maybe deal with things that your training didn't quite prepare you for. So I was curious if you could take a minute just to give some recommendations about, maybe not recommendations, but suggestions of how should physicians approach dealing with stress with patients when these patients are coming in and perhaps it's not going as well. Maybe they're having to do, more than one, like IVF, cycle, or they're getting frustrated, they're getting stressed, and the first person they're going to run into is the physician. So is there anything you can tell our physicians?
Yeah, that is another big sort of piece, I think, of this. Clinics bring such huge anxiety to our patients. And I remember when I was at the clinic, I always say that is probably the most high tension waiting room I ever walk through every morning. You can see it. Patients are rigid. They're covering their faces with whatever thing they're reading. It's just, you can just feel the tension. And I think sometimes we have to remember that is really how a lot of our patients walk through our doors. And anxiety presents in many ways. I think there's certain things that we see a lot with those patients. They read a lot and they have a lot of questions. They want to understand. And sometimes these are clinics that move fast. And sometimes we don't have time for that. And we get impatient. And I think the nursing staff sometimes really is one of the recipients of patients' stress. Front desk, people get there, they're impatient, they're angry, and it sort of gets taken out in a lot of people at the clinic. So I think part of how we help patients at that medical level is a recognition and really helping our front staff with really giving them some tools to be able to be patient, to be able to recognize that the anger might be more about the patient and the treatment than to the receptionist or to the nurse. But the other piece is that we do this all the time. We talk about levels all the time. We talk about treatment all the time. And for patients, this is the first time that they've heard many of these things. And sometimes to be able to take the time, and I think this is one of our most precious things that we have, that we don't have enough of, but to really sort of take the time to be able to answer a few questions for our patients can go a long way. This idea of bedside manner, being compassionate, when we talk about a donor, again, is one of those things that we talk about it all the time. We know it well, we know how great it is, but for our patients, those are really hard news when there's a loss. There's a really hard news. And so part of us as clinicians, we take those extra 5 minutes that can really go a long way with our patients. Sometimes when I was at the clinic again, we had a different handout sometimes. If there was a loss, there was how to cope with loss that our ultrasound technicians had in the room. And so even though I was not there to provide that support, the patient can literally walk out with a piece of paper and 8 ideas on how to help them get through that day. And so I think that the more proactive we are in sort of thinking forward, what might be sort of those touch points that we can give patients information, something to read, to look on, a telephone number. That could be one of the very important ways to connect patients with people like me that can support them through the journey.
Wonderful, wonderful. It's Stress Awareness Month, and we are talking with Dr. Ariadna Cymet-Lanski, and we're talking about stress awareness, but you are also the chair of the ASRM Mental Health Professionals Group. people would be angry with me if I didn't take this opportunity to ask you what's going on with the MHPG in 2022.
Yeah, thank you for asking that. It's actually a very exciting year. One of the things that I wanted to do as we sort of continue to expand is to really bring our group and be as relevant as we can in this sort of modern world. So I'm very excited, and I'm excited that I also get to chair at a time that we might have more opportunities to come together again. So our group is growing. We're one of the bigger professional groups of ASRM. We have over 600 members at this point, and it encompasses psychologists, social workers, and licensed clinicians, licensed mental health clinicians. We are everywhere. Literally all the states are represented in our membership. And we have a couple of international members as well. We have a very active listserv, which has been incredible to provide support to one another when we have questions, when we need resources. People can definitely use all of that. And we have an amazing mentoring group right now. We're trying to really reach all of those new professionals that are just starting in this complicated world of fertility treatment. And we're mentoring a much bigger number than we ever have. We're using a lot of technology. We're using a lot of Zooming for teaching. We're using different types of connecting people with each other to support our profession. But also to support one another. We have a social media group that is trying to actually sort of follow ASRM's each awareness month. And so we're trying to do posts that sort of match that as well. So yeah, we're active.
And of course, we're all hoping to see each other in Anaheim this year. So very excited for that. Is there a European equivalent of MHPG in Europe and like ESHRA, or is there some kind of a same group?
Unfortunately, no. We're right now the only biggest mental health group in the field of reproductive medicine. We have a few members here and there, but unfortunately, no. We're it for now.
Well, our hopes that soon that will expand and expand and expand and expand.
Yes, I would love that.
Well, thank you so much, Dr. Cymet-Lanski, for being on the show today. And I've got to have you back on again. We'll come up with some other topics and that we can cover, and of course, always be able to discuss all matters MHPG.
It will be my pleasure, Jeff. Thank you so much for having me.
Please rate and subscribe to the show on Google, Apple, or wherever you get your podcasts. I'm Jeffrey Hayes, and this is ASRM Today.
This concludes this episode of ASRM Today. For show notes, author information, and discussions, go to asrmtoday.org. This material is copyrighted by the American Society for Reproductive Medicine and may not be reproduced or used without express consent from ASRM. ASRM Today series podcasts are supported in part by the ASRM Corporate Member Council.
The information and opinions expressed in this podcast do not necessarily reflect those of ASRM and its affiliates. These are provided as a source of general information and are not a substitute for consultation with a physician.